Check your state laws and facility policy to make sure you are permitted to perform this procedure. Before positioning the person in bed, check the care plan or the nurse's instructions. Note any restrictions or special considerations. Before you begin, practice hand hygiene. Identify the patient and make sure that privacy has been provided. Follow all additional instructions in the preparation section of this program.
Hi. My name is Alicia, and I'll be your nurse assistant for today. Can you show me your wristband and give me your name and date of birth, please?
Joan Germer, November 1, 1926.
Okay, great.
To move the person to the side of the bed, raise the bed to a level that provides for good body mechanics and explain to the person what you are going to do. When positioning the person in bed, regardless of the method being used, bed wheels should be locked. Lower the head of the bed to a level that's appropriate for the person. It should be as flat as possible. Stand on the side of the bed to which you will move the person. If the bed rails are up, lower the one near you.
I'm going to pull your blankets back, okay?
Okay.
As directed by the nurse, remove the pillows.
Now relax your head. Okay.
Now stand with your feet about 12 inches apart. With one foot in front of the other, flex your knees. Cross the person's arms over her chest. When you are moving the person in segments, place one arm under the person's neck and shoulders, grasping her far shoulder. Place your other arm under her mid-back. Move the upper part of the person's body towards you, rocking backward and shifting your weight to your rear leg. Next, place one arm under the person's waist and one under her thighs. Rock backward to move the person's torso towards you. Repeat the procedure for the person's legs and feet with your arms under her thighs and at her calves. When moving the person with a draw sheet, arrange for a coworker to help you. Make sure that both bed rails are lowered. Explain to the person what you are going to do. Roll up the draw sheet close to the person. Grasp it near his shoulders and hips as your coworker does the same. Support the person's head. On the count of 3, rock backward, moving the person towards you.
1, 2, 3.
Your coworker rocks backward slightly and then forward toward you while keeping her arms straight. Now unroll the draw sheet and remove any wrinkles. To turn and reposition the person, lower the head of the bed as you saw earlier. Stand on one side of the bed opposite where you will turn the person and lower the near bed rail. Move the person to the side of the bed as you saw earlier. Once the person's arms are crossed over her chest, cross the leg near you on the far leg. When turning the person away from you, stand with a wide base of support and flex your knees. Place one hand on the person's shoulder and the other on her hip near you. Then roll her gently away from you toward the raised bed rail, shifting your weight from your rear leg to your front leg. When turning the person toward you, stand on the side of the bed opposite where you will turn the person and lower the near bed rail. Move the person to the side of the bed near you. Raise the bed rail, go to the other side of the bed, and lower that bed rail. Now stand with a wide base of support and flex your knees. Place one hand on the person's far shoulder and the other on her far hip. Then gently roll her towards you. After turning the person, position her according to the nurse's directions and the care plan. For example, place a pillow under her head and neck. Make sure the face, nose, and mouth are not obstructed by the pillow. Position a pillow against her back. Adjust her shoulder so that she does not lie on an arm. Flex her upper knee and position her upper leg in front of her lower leg. Support the upper leg and thigh on pillows, making sure the ankle is supported. To log roll the person, make sure the bed is flat. First, move the person to the side of the bed with a coworker and an assist device as you saw earlier. If the person has a spinal cord injury, assist the nurse as directed. Next, place the person's arms across his chest and place a pillow between his knees. Stand near the person's shoulders and chest while your coworker stands near his hips and thighs. With a broad base of support, stand with one foot in front of the other. Ask the person to hold his body rigid. As he does, roll the person toward you, using the assist device if desired, and turning him as a unit. Now position the person in good alignment, as you saw earlier. As directed by the nurse and the care plan, place pillows as you saw earlier. After positioning the person in bed, perform post-procedure care. For example, lower the bed to a safe and comfortable level appropriate for the person. For detailed information, see the section on follow-up care, reporting, and recording in this program.